Case like this, I would request all the audience and the respected panelists to speak on this. You have a picture like this, the patient comes to you and you have the disc there, the fibrous element, neovascularization. There are changes in the macula, clinically significant macular edema is there. There is a little bit of pre-retinal hemorrhage here and there, hemorrhages are there, veins are dilated. What would be your line of treatment at this stage? Dr. Manish first.
Some of the audience members.
Anybody from the audience?
Sir.
This is a laser session, so most
Yes,
of the answers will be. How would you like to do?
Answer from the audience.
Anti-VEGF.
Okay.
But maybe there is some vitreoretinal adhesions also.
This patient has got.
It will lead to the retinal detachment.
Okay.
Actually, there is traction, so.
No, so OCT is okay.
This patient has got both the things, so maculopathy and the neovascularization. So you have to treat the maculopathy first. So do the OCT assay. See
Yes.
how
Yeah.
and
So
treat the maculopathy first.
So would you the point is, how would you like to treat the maculopathy here, sir?
So do the OCT. If it's a focal only, if you find a leak, focal only, there do the focal laser.
So
Because the anti-VEGF will give only.
So yeah, this is a good idea of treating the maculopathy first. The point which we wanted to emphasize is these membranes, when they are looking as vascular as this fibrovascular membrane is, the moment you start putting the anti-VEGF, this macula is going to contract and pull up the retina. So these are the patients where you would like to treat the maculopathy either with a grid laser or an steroid. The idea of anti-VEGF should be avoidance of this particular this thing, because it is going to pull up if there is a crunch effect. The sudden the VEGF falls down and the this entire membrane will contract, and that is going to pull up the retina. So you will induce a tractional retinal detachment.
Okay, so we'll do OCT, we'll do angiography, and no anti-VEGF at this stage.
Because
At
there
this
will be
moment,
As a first shot.
First treat the macula.
if same thing, if this fibrovascular proliferation had less of vascularity, if it was not as angry looking this thing, then anti-VEGF is also a good choice. But when it is a treatment naive eye, these eyes may pull up very fast if you put anti-VEGF.
Okay,
It is
thank you,
if
Dr.
it is
Manish.
white,
Thank you. We have another question.
we will imagine like what it looks. The vision should be reasonably okay. So like the idea is to just give what
somebody is raising his hand. Yes.
Yes, please. Yes, please.
Peripheral lasers can be given in this patient.
Yes, sir. Peripheral laser away from the fibrovascular. You will not hit the fibrovascular proliferation, because again the same thing will happen. The fibrovascular proliferation will contract. And
You have a patient like this coming to you from your friend, and what would you look for, and how will you manage this case? So here are laser shots given, nicely and properly given. There are some changes in the macula. This is okay.
this is
Okay. No,
Okay, third
but how
session will
you
be needed.
manage? How will you manage this case? Would you like to do further laser?
Further
Would you
laser.
do angiography? Would you do OCT? Yes, because it's very important to do angiography in this case, because the patient has come unsatisfied from that doctor, because he was not getting any improvement. He was doing like I keep on doing laser photocoagulation, then he goes to Manish Tandon. कि यार वो विजन तो इम्प्रूव करने भी पैसा लिए ले रहे हैं हमसे. Yes, yes, thank you.
Sir, the patient is not happy for two reasons. One is the macular edema.
Yes, do a OCT. Yes,
And secondly, laser has been done.
yes,
Macula is so white.
yes.
Maybe there is macular ischemia. And
So angiography is also important to look for any neovascularization and the macular ischemia.
Usually would have done an angiography before doing this. So would you repeat it because the diabetics with bad kidney function?
Yes. You see, it's relatively contraindicated every time you don't do laser photocoagulation,
The other thing that I was going to tell about was that how do you manage this patient is ask him to control his renal status, control his blood pressure, stop smoking, control his diabetes, control his anemia. These medical conditions have to be controlled, and you have to talk to your physician friend also. So in a renal function derangement, angiography is relatively contraindicated, so that you can know.
We have
Now this patient has come
we have
here.
Octa now. So that is a simple procedure. Octa is good enough.
No,
I mean,
Yes, yes, all kinds of patients. Very good, very good.
it's a,
This is my always, I am claps for him. Because many a times we are thinking of doing cataract in all the cases, whereas SICS is very good. So we have to talk about our patients and our doctors and our population.
a lot of
Very
doctors who
right.
have Octa do it free of cost as well. You don't have
Free
to
of
treat all
cost, how
patients. You can
a
refer the
young person
patients.
can do it?
Let the other person will take care of that
So
patient.
okay,
You don't have to treat all
another case,
patients.
another case like this coming to you, some with OCT, done at some place where it was done free of cost, and but he has come. He has come to you. Yes, Pranav, what will you do?
I would go for a anti-VEGF in this case, but again, I would go for a fundus fluorescein angiography. The thing is, the EZ is intact in these cases, but the cystic spaces are look older in these cases, so we can also go for a steroid.
This is a
Injection.
date.
Now, audience, somebody would like to answer here.
Anybody from audience?
Please
Yes.
go ahead, sir.
Yes, sir. Yes, doctor.
Yes.
Can do.
Again, have to see the phakic status
Yeah,
in this.
please go ahead, sir.
Yes, doctor साहब आप बताएं. Yes. Look for
We
the
will-
systemic,
we will first,
as
sir,
he has
very
said.
important.
Yeah, I
Look,
agree, sir. We'll investigate all
Examine
diabetic
the other
patients.
eye.
But you
Is it diabetic retinopathy leading to this kind of
Bilateral
edema? Or is it
CRVO, CRVO. So you have to examine the patient thoroughly, and then
the
then
point-
Dr. Manish will come to tell us.
yes, the point here is, like sir had, and he had said that ellipsoid zone is broken here. So number one, this prognosis doesn't look as great. Number two, a lot of times we will be tempted to believe that this is cystoid macular edema. But please remember, there are 2 or 3 different words which have to be taken with a lot of caution. One is cystoid macular edema. Second is cystoid macular degeneration. The third is chytic retina. So can we go back to this?
Oh.
So I'll finish off this very quickly.
Yeah,
So
yeah,
the point here is, this looks like a degenerated retinal tissue. So if you start giving anti-VEGF, a lot of times you are going to fail. So these are the patients where first of all you'll have to prognosticate. Tell that even if we treat, you may not recover your full vision. Yes, because the retinal disorganization will improve, some vision will recover, but he may never gain the full because of the obvious loss of the ellipsoid zone there. So these are the patients who are very, very good candidates for steroid usage.
Thank you. Can guy go ahead for another?
Would you go for a trial of anti-VEGF in these cases? Like if the patient is treatment naive,
No.
and directly you will go for a steroid.
Yes. What will you do in this case? Yes, sir, from the audience.
OCT is to be done.
OCT
And
is
then
to be done, and
so
okay, baseline investigation has been done. What would you do for the peripheral area? Okay, very good. Yes.
so somebody would like to comment what kind of focal has been done. You can see some spots there which are seen in bit of parafoveal maybe.
You see,
So-
they have mentioned here that focal laser has been done.
So- No, the point here is those kind of focal spots were actually not indicated. You don't have to treat 1000 micron away from fovea and do a focal laser. It is not. See, there are two different words. One is called CSME, that is clinically significant macular edema, and the other is non-CSME, non-clinically significant macular edema. So where the focal has been done, this would have been a non-clinically significant macular edema. It would have never affected the vision. So when we talk of the fovea involving macular edema, there could be two different scenarios. One, when the leakage is within the 500 microns, and these are the patients where you cannot do a laser. But if you have leakage which is involving the macular, which is causing macular edema, but the leakage is outside, these are the patients which are very good candidates for a grid laser, which is a very cheap option.
Actually, the ICO guidelines have come. They have said that central involving macula, non-central, as Dr. Manish. So if there is central involving edema, you cannot do laser. You have to give anti-VEGF injection. If it is there is edema not involving center, then you can do focal laser photocoagulation. So in this case, further investigations are required.
I think so. One more image would be fine
that.
because we are running out of time.
Yes, that is why I want to show you another picture. Diabetic macular edema with pan-retinal photocoagulation done, and this is the picture of macula. Yes, sir. Anybody from the audience? I think our time is over. The other speakers are waiting.
Yeah, you'll treat this patient, but remember, when you have so much of exudates, it means only two things. Either the patient's lipid profile is really deranged, or this is a very chronic one. So if the lipid profile is extremely deranged, you'll instead of treating and making this hard exudate, which is away from fovea, to come and sit right into the fovea and the patient drops the vision, start anti-lipid therapy first before you treat. The second point is, Tricort is the only drug which is known to actually absorb the lipids from the macula. So these are the patients who would be, if it is a chronically leaky perifoveal capillary network, so these patients will be very good candidates for steroids again.
As basically they say today, first thing is when a patient comes to you, you advise lipid profile, serum urea, creatinine, as doctor was mentioning. Hemoglobin is also very important. Some of the studies have come. If patient is anemic, check his blood pressure. These parameters must be controlled first, then you must jump on to other treatment other than the intravitreal injection that you have. So as rightly pointed by Dr. Manish, you have to control all these things, and then only you have to go in for further. We have 3 minutes more.
Yes, sir.
This is
please carry on.
0.05 cc is good enough now, sir.
2 milligrams versus 4 milligrams. There are studies, and I have been giving Tricort right and left in almost all the cases. 0.05 sir. थोड़ा सा हिला लिया करिए उसको ना इंजेक्शन थोड़ा सा हिला लिए 3 to 4 months टाइम के बाद आप दोबारा ये this is another case, persistent diabetic macular edema, ये तो हो गया. Now here what will you do? This is the last slide before we finish. This is FFA done. What will you do? The laser marks are there. Focal laser marks are there. These are some of the, what are these? These hyperfluorescent spots, microaneurysms. So many microaneurysms you cannot see by fundus examination. For that you have to do angiography, and you will see that there are
more number of microaneurysms seen. And there could be a leaking microaneurysm, a non-leaking microaneurysm. If you have a fuzzy margin, that means that there is leaking microaneurysm, and then you have to directly do a focal photocoagulation. So thank you so much, my chairman sir, Professor Shrikant, Dr. Manish Tandon, Dr. Pranav, Dr. SP Singh, other audience, all the residents and postgraduates from MDI and all the delegates.
The angiography was showing aneurysms which were very close to fovea. So these are the patients which are not fit for lasers. So you will be treating them with. Thank you, audience, for your
Thank
nice
you, everybody.
participation.
Thank you. We can have a photograph.
एक मिनट कुछ फोटोग्राफ तो ले लें फोटोग्राफ लो यार बैठे रहिए